guest today is Sandro Galea. Sandro is the Dean of our School of Public Health here at Boston University, and we're going to ask him what he thinks the future of mental health might look like in a post-COVID world.
I suppose the way I would approach it would be to think about now and to think about then. So now, during a time of COVID, there is no question that we are beginning to see, and we will be seeing for the next several months, a increase, perhaps dramatic increase, in mental health problems. Depression, generalized anxiety, post-traumatic stress, more substance use, more smoking, more drinking. Now, that's the now. Now let's talk about the future, the next on mental health. Well, my hope, and perhaps I'm being optimistic, that the wider prevalence of these common mood anxiety disorders will mean that we will break down the barriers that continue to haunt our discussion about mental health. Mental health remains stigmatized. Mental health remains something that we do not talk about. In a time when there is such a ubiquitous exposure, which is the coronavirus, we have an opportunity here to change the conversation on mental health and to say mental health is as important as physical health, and people with mental health problems should have access to services the way we have access to services when we have a physical health problem. If we have diabetes, if we have a broken arm, if we have a headache, if we have a heart problem. And so in the long term, I am wondering whether this is not an opportunity. It's not an inflection point where mental health in the future can be recognized at a par with physical health.
How do you think individuals and societies will take this memory of now into the then?
It's reasonable to think of the coronavirus as a trauma. It's a traumatic event. It's a trauma that's happening to all of us. That's what's unusual about it. It's actually happening to essentially all of us. A trauma, by definition, is an event that threatens our mental or physical well-being, that threatens our sense of safety, and that threatens our social connections. We know that when humans experience traumatic events, they are more likely to have mental health problems. They're more likely to have depression, to have anxiety, to have post-traumatic stress. And we also know that when we experience a traumatic event, we are more likely to be vulnerable to the effects of other traumatic events in the future. So I think the now is increasing our collective vulnerability to risks then in the future. There are two, not one, but two real threats to mental health right now. One is the coronavirus itself. The other one are the economic and social consequences. And the economic and social consequences stem both from the virus itself, but also from our response to the virus. So these social and economic problems compound our risk of mental health problems. And when you understand it that way, you realize that, well, what's the best thing we can do to mitigate the mental health consequences? Well, number one, we need to get the coronavirus epidemic under control. Number two is mitigating the social and economic consequences is really a health intervention. Helping people pay the mortgage, get employed, have their kids in school, look after their elderly parents, make sure they have the social connections that they need. That is a mental health intervention.
How do we take this experience of isolation into the post-COVID world?
The human journey was designed to be shared. It wasn't designed to be lived alone. I suppose at a very simple level, I hope we emerge from that robustly and re-embracing a full range of social connections. But I am pretty clear that in the now, what we need to be doing is closing social gaps as much as possible, even while maintaining physical gaps for the sake of mitigating the spread of the virus. And I really think that it is on us to create a world which is as richly textured social connections as we've ever had, and perhaps more so, because it's going to be even more important in the future, perhaps, than it was in the past.
What is your best hope? What might we learn from this shared moment of stress?
My hope is that COVID reveals what we should have known already, but sometimes it's hard to see. A healthy world and a better world are the same thing. So our incentives are aligned to get this right, to create a world that is compassionate, that respects people, where everybody has an opportunity for a livable wage, working within a fair economy, where there is gender equity, people have stable housing, people have nutritious food, where we have clean air, drinkable water. All of those forces ultimately will create a healthy world. And if we can use the now of COVID, as incentive to create the then along those lines, then this will end up in the long arc having been a positive moment for the world.
What would be your worst fear?
I worry that we will not learn our lesson in COVID. I worry that we will not learn that the world deserves better. I worry that we will not realize that the reason COVID has had such devastating consequences in the US and in other parts of the world is because we have not invested in what makes us all healthy. And if we do not learn that lesson, then really it's a pity.